Perimenopause can start early. For some women, it's a transition before full menopause. So it's a range of time. It could begin in the late 30s or 40s for some. The symptoms include irregular periods, right? So that's a key one. If you are going through some of the symptoms, we're really looking to see some changes to your cycle pattern: hot flashes, mood swings, sleep disruption, and changes in libido. And this sort of like lingers on until you certainly start skipping and ending the phase of perimenopause with no more menstrual cycles. If you see persistent changes, I'd still advise getting hormone levels checked and talking to a doctor, because there are both hormonal and non-hormonal ways to ease symptoms, but you should be evaluated. Are there blood tests that you can take to check to see if you're in perimenopause? Yeah, so common tests might include getting an FSH done, that stands for follicle stimulating hormone, which is an indicator of your ovarian function, and if it's declining. An LH level also evaluates your ovarian function as well. Estrogen levels, checking a thyroid is key, because thyroid disorders can mimic perimenopause or perimenopausal symptoms. Prolactin, which is another hormone with high levels that can interfere with your periods and cause symptoms that could mirror perimenopause as well. Checking things like your vitamin D, a key, iron levels, because a lot of times you're anemic, and of course lipid and cholesterol, diabetic screening, those things, because some of those risk factors may make you have symptoms that mirror perimenopause as well. So basically, there's no single test definitively to diagnose perimenopause. It's a clinical diagnosis, but the blood work helps to guide management and rule out other causes. So it was asked, why do women with PCOS often feel dismissed by doctors, and what to do about it? So studies in 2025, more recent ones, show PCOS patients report feeling ignored or having symptoms dismissed by providers pertaining to weight, acne, and infertility concerns. So what you can do, track your symptoms, document your symptoms. As you track these symptoms, then you could request specific tests like a testosterone profile, insulin level, get your pelvic ultrasound done to evaluate your ovaries, and seek a provider who takes a patient-centered approach. I think is the best way I could explain that. So, you tap into someone who actually seems to work in the world of PCOS as well. There's no one size fits all cure for PCOS, so that's important, which is why I'm like stumbling to answer this one. So some women will have irregular periods from hormonal imbalances. Some may have fertility challenges, acne, excess hair, or insulin resistance. And many have a mix of all of these. So the treatment will depend on your goals, whether you want to regulate your cycles, whether you want to improve your fertility chances, manage your weight, or reduce symptoms in general. So one patient, or one woman rather, might need the birth control pill. Someone else might need metformin, or function just fine just based on nutritional and lifestyle changes. So researchers also believe there's genetics at play, environmental factors, stress plays a role. So it's not something that can be fixed overnight, and it's about managing it with long-term and more personalized care. So bottom line, PCOS is it's complex, it's treatable, it just takes the right plan for your body. Yes. The answer is yes. That was a quick one. But basically, achieving a healthy weight before conception can improve fertility, reduce pregnancy complications, supports a healthier pregnancy overall, and here's why. So women with overweight or obesity factors compounding a pregnancy may experience take longer to get pregnant, longer time to conceive because there's more irregular ovulation. Being a more healthy weight reduces the risk of gestational diabetes, high blood pressure, and complications like preeclampsia and issues at the time of delivery. Losing even 5 to 10% of your body weight improves your fertility prior to getting pregnant, and this is proven with fertility markers improving and overall metabolic health improving as well. So if you are trying to conceive and you are overweight or obese, focus on just gradual, sustainable lifestyle changes, balanced nutrition, regular physical activity, manage your stress or reduce your stress or eliminate your stress. Extreme dieting and rapid ups and downs, rapid weight loss can backfire, right? That yo-yo, and this negatively impacts your fertility chances as well too. But always discuss your individual situation with a healthcare provider when you're trying to conceive, and in as far advanced as possible as well too. And the bottom line is weight management is about optimizing your health for your pregnancy and your future baby, right? Which screening should you prioritize depending on your age? In your 20s, basic rule, get your pap smear. You don't need to get HPV DNA screening. It's very something to discuss, but definitely get your pap smears done. STI screening needs to be done, and again, depending on other symptoms, overall general wellness checkups. In your 30s and 40s, definitely pap smears on HPV DNA testing, clinical breast exam, which is done by your gynecologist usually, cholesterol screen, and thyroid screening. I advocate for at least every 3 years, especially in your late 20s, 30s. At age 40s, when you start getting your mammogram, that type of breast imaging screening could be done earlier depending on your family risk factors. After 50, colonoscopies, colon cancer screenings, bone density scan in your 60s, menopausal and cardiovascular checkups and so forth. So it adds on as you get older. Mild cramping or discomfort is common, right? As women menstruate, the severity that disrupts daily life activities, this very pain that's not responsive to just basic over-the-counter anti-inflammatories, and especially if it gets worse over time, that's not normal. So it could signal endometriosis, adenomyosis, uterine fibroids, pelvic inflammation in some other way. If it's severe or if it's a new feature for your period, then you should be evaluated by a gynecologist. All right, I know this one is searched a lot online. So does the color or odor of vaginal discharge always mean infection? Not always. Vaginal discharge changes are normal across the menstrual cycle. It goes from thin and clear to more mucoid, sort of gelatinous even, to thicker and milky discharge before the period. But red flags include a strong foul odor, a green or yellow or gray color, accompanied with itching, burning, pain, swelling of the labia, changes that are abnormal to you, changes that are persisting or recurring. These likely signal some form of an infection, especially BV, which is the most common, and yeast infections, but of course we have to rule out STIs. So if you're concerned, it may warrant medical evaluation. Okay, I could vouch for this one being a common question. I hear this on a weekly basis at the office. Is PMS just in my head, or is there a biological basis? So PMS, or premenstrual syndrome, has a real biological basis, not just in your head. There are cyclical hormonal shifts, especially estrogen and progesterone, right? So these interact with neurotransmitters that send signals to our brain via our serotonin and our GABA receptors to trigger mood, sleep, bloating, and other physical symptoms. So in the 2025 discussions and research, there's more attention being paid to PMS as a hormonal and biochemical phenomenon, not just cultural or psychological. And this also now pushes the trend more towards better hormonal wellness and better validation at that time as well, too, that it is a real entity. Management strategies, lifestyle changes, diet, sleep, and exercise adjustments during this window of time. For some women, when it's really severe, selective SSRIs are sometimes prescribed just in the luteal phase. Magnesium, which I talk about a lot, and sometimes there are hormonal options for more severe situations. So that's a wrap for You Ask Doc About, the Flashcard edition. Quick answers, real facts, no fluff, just the way that we like it. And I hope these episodes continue to help you feel more informed and empowered about your health. Remember, your health questions deserve real answers. So keep them coming in the comments. And don't forget to like this video, subscribe to our channel, and share this video as well. And I'll see you next time for another round of You Ask Doc About. Stay blessed. Book an online consultation with me for a one-on-one discussion of your specific concerns. Bookings for online consults can be made easily via our website. You'll see all the details below, but visit us at azaleahealthtt.com.